Okay, hi, my name is Nora Amro. I'm a student nurse practitioner and I'll be conducting your head-to-toe assessment today. Throughout the course of this exam, I will be examining your skin for any color, edema, bruising, lesions, nevi, moisture, texture, temperature, and turgor, okay? What's your name?
Hannah.
Hannah, okay, it's nice to meet you. So I'll go ahead and start your exam. I'll first conduct hand hygiene, and then we'll start your exam with your head, okay? So I'm just gonna basically be checking for shape, symmetry, midline position, which all seems to be appropriate, size is appropriate. And if you allow me, I'll go ahead and check your scalp. Okay, and we're just looking at hair color and distribution. We're looking at texture, looking for any infestations, masses, depressions, lesions. Do you have any tenderness?
No.
Okay, good. So now I'm gonna go ahead and go forward and check your temporal arteries. Do you have any tenderness?
No.
Okay, good. I'm gonna check your TMJ. Can you open and close your jaw for me? Yep. Good. Any tenderness?
No.
Okay, no subluxation or crepitus notice. So now I'm gonna go ahead and palpate your preauricular node and lymph nodes, postauricular, occipital, posterior cervical, anterior cervical, supraclavicular, okay, tonsillar, submandibular, and then your submental. Okay, now I'm going to go ahead and check for a trachea midline position, which it appears to be, and then I'm going to go ahead and palpate your thyroid. Okay, good. And then I'm going to move on up. We're going to check for any tenderness or pressure in your cheeks. Anything in here?
No.
How about in your frontal sinus?
No.
Okay, so no maxillary or frontal sinus tenderness noted. Nose appears midline and straight. Let's check patency. So if you can occlude your nostril and breathe out for me. Okay, good. Now do the other side. Great. Now I'm going to check your ears for shape and symmetry and position, okay? Which they both appear to be symmetric and size is appropriate. Check for any tenderness. Any tenderness?
No.
Okay, no tenderness of the pinnae or the tragus. So I'm going to go ahead and move on with your cranial nerve function test, okay? So we'll start with cranial nerve 2. So if you could, take the smell and eye chart for me, hold it arm's length away and cover your right eye and read the smallest line you see.
ABC 1, 2, 3.
Okay, good. Now do the other eye for me.
ABC 1, 2, 3.
Great. Now do both eyes.
ABC 1, 2, 3.
Okay, good. Now we'll do peripheral and central vision. So what I want you to do is cover your right eye, and I want you to tell me how many fingers I'm holding up.
2, 1.
Okay, now the other eye.
1, 2.
Okay, great. Then we'll go ahead and do cranial nerves 3, 4, and 6. So first we'll go ahead and check for consensual and pupillary response.
Okay.
So I'm going to shine a light in your eye. I want you to look straight ahead for me. Okay. Okay, one more time. Okay, good. Pupils are equal round reactive to light, and consensual response is noted in both eyes. So what I'll also go ahead and do is we're going to go ahead and test for convergence and accommodation. So I want you to look straight ahead, don't move your head, and follow my finger with your eyes. Okay, great. Then we're going to go ahead and check conjugate gaze with the 6 cardinal fields of gaze. So I want you to do the same thing, don't move your head, and just follow my finger with your eyes. Okay, good. And then quickly, I'm going to go ahead and check for red reflex in your eyes with my light. So if you look straight ahead for me. Okay, and the other eye. Okay, red reflex noted in both eyes. Sclera and conjunctiva color are normal. No masses, no lesions, no discharge of any kind. Lashes, palpebral fissures, and brows appear within defined limits. So we'll go ahead and check cranial nerve 5. I'm going to palpate your masseter muscle, and I want you to clench your jaw for me. Okay, good. Now what I want you to do, I want you to close your eyes. I'm going to put a cotton ball on your face. I want you to tell me where you feel it, okay?
Forehead, cheek, chin, cheek.
Okay, good. And then we're going to check cranial nerve 7. So I want you to smile for me. Good, frown. Pucker up your lips, puff up your cheeks, raise your eyebrows. Okay, no asymmetry noted. And then we're going to go ahead and do a few ear tests with the for cranial nerve 8. So first test we're going to do is the whisper test. So I want you to cover your right ear, and I'm going to whisper a word, and you tell me what you hear.
Apple.
Okay, good. Now do the other ear.
Banana.
Okay, good. Now we're going to do the Weber test for lateralization. So I'll put this tuning fork on your head and you tell me if you hear it equally throughout.
Yes.
Okay, good. Then we'll do the Renee test. And so I'm going to put this tuning fork behind your ear. And then I want you to tell me when you stop hearing sound. And then I'll put it in front of your ear and ask the same thing.
Okay. Mm-hmm. Okay.
Okay, good. So air conduction appears to be greater than bone conduction. And now we'll go ahead and assess your throat and mouth features alongside with your cranial nerves 9, 10, and 12. So if you could just open your mouth for me. Say ah. Okay, ubularized is symmetric. Posterior pharynx appears to be normal. If you could stick your tongue out all the way, move it side to side, lift it up. Okay, gums, teeth, palate of the mouth, floor of the mouth, salivary ducts all appear normal, lips appear normal. Okay, and then we'll go ahead and do cranial nerve 11. So I'm gonna put some resistance on your shoulders and shrug for me. Okay, good. And then we'll do some head and neck range of motion. So if you could just follow my movements. So just chin to chest for flexion, back up for extension, and then all the way up for hyperextension, side to side for lateral flexion, and then touch your head to your shoulders for rotation. Any tenderness with any of that? Okay, good. Now we'll go ahead and move on to your lung and chest exam. So just looking at you, your breathing pattern appears to be normal. You don't seem to be in any distress. I don't see any nasal retractions, no use of accessory muscles. You're not in the tripod position. You're not cyanotic. You're not tachypnic. And your chest appears to be anteriorly and posteriorly symmetric. So I'll go ahead and start my exam. I'm going to check for tactile fremitus. So I want you to say 99 anytime you feel my hand on you.
99. 99. 99. 99. 99, 99.
Okay, good. Now what I'm going to go ahead and do is I'm going to percuss the back of your chest. If you can move your hair for me. Okay, great. Okay, good. And then I'm going to go ahead and listen to you behind over here, okay? So just take a deep breath whenever you feel the stethoscope on your back. Okay, good. Now I'm going to do egophony. So I want you to say E whenever you feel the stethoscope on your back.
E, 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 E.
Okay, good. Bronchophony, I want you to say 99.
99, 99, 99, 99, 99, 99.
Okay, and whisper pectrilically, I want you to whisper 1, 2, 3.
1, 2, 3.
Whisper. Okay, great. Now I'm going to go ahead and listen to the front of your chest. If you could just turn back the camera for me. Okay, good. And then real quickly, I'm going to palpate for your carotid pulse, okay? Okay. Carotid pulse present on both sides, and I'm going to listen for any bruise. So if you can hold your breath for me. Okay, no bruise noted. Now I'm going to go ahead and start your other heart exam. So I'm going to go ahead and listen to your heart. So aortic, second right intercostal space, pulmonic, left second intercostal space, Orbis point between third and fifth intercostal space, tricuspid in the fourth intercostal space, and mitral in the fifth left mid-clavicular intercostal space. And then I'll listen again with the bell. Okay, and I would listen to the point of maximum impulse, and that's in the left midclavicular fifth intercostal space. I would listen to the apical pulse for a full minute, but due to the time constraints of this exam, I'm not going to do that. And now if I could just have you lie down, so we'll do the same exam again. I'll listen with the bell and the diaphragm, again, to the heart landmarks. And while I'm down here with my stethoscope, I'm going to go ahead and also listen to your renal arteries. So aorta, renal, iliac, and femoral. Okay, good. And then real quickly, I'm going to palpate for any thrills of your heart landmarks. Okay, no thrills noted. And if this were at 30 to 45 degree, I'd be checking for jugular pulsation, which would be present, and I'd be making sure that there's no jugular venous distension, which shouldn't be there. Now I'm going to go ahead and start with her abdominal exam. So I'm going to go ahead and listen, okay? Just looking right now, contour is flat. I don't see any masses or lesions, and it appears to be symmetric. Okay. Bowel sounds are normal, active in all four quadrants. So I'm going to go ahead and percuss for tympany. Okay, good. And then what I'm going to go ahead and do is I'm going to do some palpation. Do you have any tenderness?
No.
Okay, good. And then deep palpation. And then we're going to check for our liver. So what I want you to do is I'm going to hook my hand under your rib. I want you to take a deep breath and then let it out. Good, now liver filled. And then I'm going to check for your spleen. So I'm just going to push here and then palpate. Any tenderness?
No.
Okay, good. So now if you could just sit back up for me. I'm going to go ahead and check for CVA tenderness. So if you could just turn your back to the camera. Okay, you're going to feel thump back here. Any tenderness?
No.
How about now?
No.
Okay, great. So no CVA tenderness noted. So then we'll go ahead and conduct the rest of your exam, the musculoskeletal and the neurological exam. So during the course of this exam, I will be looking at your upper and lower extremities and your joints. I'll be checking for any color, swelling, edema, nodules, lesions, deformities, and any tenderness and temperature. Okay, so we'll start with your hands. Okay, I'm gonna check cap refill. Okay, let me see that one. Okay, cap refill less than 3 seconds bilaterally. And I'm gonna go ahead and palpate all your joints. Do you have any tenderness?
No.
Okay, checking the wrist and the elbow and then the shoulder. Any tenderness?
No.
Okay, let's do this side. No tenderness?
No.
Okay. Okay, good. Now what we're going to go ahead and do is let me check your pulses real quick. Okay, radial pulses are 2+. Grab my hand for me. Good. Okay, hand grip is 5. And now we're going to go ahead and do some range of motion with your fingers. Okay, so just follow my movements. Okay, I want you to bend your fingers downward for flexion, bring them back up for extension, then hyperextend them for me. Okay, good. Now fan them out for abduction and then bring them back in for abduction. Okay, and then what I want you to do, we're going to do the same thing with the wrist. So bend downward for flexion, back up for extension, up for hyperextension. Then I want you to rotate them. Okay, good. And then we'll do ulnar deviation outward and then radial deviation inward. Okay, good. And then I want you to do, follow my movements. We're going to do cerebral function testing with rapid hand movements, okay? So put your hands on your lap, and I want you to flip them back and forth. Okay, good. Now I want you to do serial finger opposition. So I just want you to touch your finger to your thumb. Okay, great. And then I want you to touch your finger to your nose to my finger. We'll do this 12 times. Okay, good. Now do the other. Great. Okay. Now what I'm going to go ahead and do is I'm going to check for any vibratory sensations on your ulnar prominence. So just tell me if you feel any vibrations.
Yes.
Okay.
Yes.
Okay. And I'll also go ahead and do the one on the medial malleolus.
Yes.
Okay.
Yes.
Great. Then we'll go ahead and move on to the, we're going to check muscle strength of your biceps. So if you could just flex your elbow, yep, just like that. Okay, good. Now I want you to flex against resistance. So flex again. Okay, good. Now push downward. Okay, good. 5 out of 5 strength on the right. We'll do it on this side. Good. All right, push. Okay, good. So 5 out of 5 both sides. And then what I want you to do is I want you to extend your elbows back this way. Okay, good. And that's hyperextension. Great. Now bring it back up front. Okay, good. And I'm going to go ahead and check your feet real quick. Okay. So I'm going to check dorsalis pulses. Okay, and posterior tibial, 2+ for both bilaterally. Okay. And then I want you to put your feet on top of my hands and then push down. Okay, now I want you to pull up. Okay, dorsiflexion, plantar flexion, 5 out of 5 strength. And we're going to check calf refill in your toes. Okay, calf refill is less than 3 seconds in all toes. And I'm just going to palpate your ankles. No tenderness or anything?
No.
Okay, any tenderness in your knees? Okay, great. And then what I want you to do is we're going to do some toe exercises as well. So if you could just bend your toes forward for flexion. Good. Bring it back for extension. Now hyperextend them. Good. Now fan them out for abduction and then bring it back in for abduction. Good. And then we'll do some feet exercises, so just follow my movements. Okay. So we did dorsiflexion, plantar flexion. So I want you to bend, just out like that. Then bring it back up. Okay, good. Now I want you to rotate inward for both. Okay, now outward. Okay, and then rotate them around. Great. Okay, good. And then we're going to assess knee strength. So what I want you to do is I want you to try to pull up against my hand. Okay, good. Another one. Okay, and then try to bend them. Okay, great. 5 out of 5 bilaterally in strength. And then we'll do also shoulder strength as well. So I'm going to put some resistance on your shoulder. I want you to kind of push against that, okay? Go ahead. Okay, good. Now bring it in. Okay, great. So 5 out of 5 strength there. And then we'll do some range of motion of the shoulders as well. So I want you to bring them outward like this for abduction. Then bring them inward like this for abduction. Good. Then back out, circumduction, forward, and then backward. Okay. Now up here behind your neck for external rotation, and then behind your back for internal rotation. Okay, great. And then I want you to bring them all the way up here for flexion. Okay, good. So now what we need you to do is I need you to lie down. I'm going to check your hip range of motion. So I'm going to bring this foot. If you could bring it up. Okay. All right, we're extending. Good. Flexion. Good. Now bring it back down. Do the same thing with the other leg. Okay, good. And then what I want you to do is I want you to push this outward. Okay, good. Now bring it back in. Good. Internal, external rotation, normal. Do this leg for me as well. Okay, good. And then you can sit back up. Okay, now we're going to go ahead and do some walking tests. So if you could just do a regular walk right over there for me. Okay, and walk back. Okay, good. Now we're going to do tandem gait. So I want you to walk heel to toe there with your eyes open. And then on your way back, I want you to close your eyes. Okay, great. And then if you could hop on one foot for me, and then the other one. Okay, good. And then we're going to do check proprioception. So I want you to just stand still and just look straight ahead for you and check for excessive swaying. Okay, no excessive swaying noted. Now I want you to close your eyes. Okay, no excessive swaying noted. Now I'm going to go ahead and check your spine, okay? So what I want you to do is if you could just bend forward for me, flexion. I'm checking for any scoliosis or any tenderness. Any tenderness?
No.
Okay, good. Curvature appears appropriate. And there's no tenderness noted and no scoliosis noted. So if you could just follow my movements now. So we already flexed. So we're back and extended. I want you to push back for hyperextension. Okay, good. Now I want you to go side to side. Good. And then I want you to rotate. Just slowly. Yep. Perfect. Okay, good. And then real quickly, you can sit down for me. And I'm going to go ahead and do some other tests. So what I want you to do is I want you to hold your hands out for me. I'm going to place an item and you're going to tell me what's in my hand, what's in your hand, okay?
A key.
Okay, good. Now I'm going to move this one.
Coin.
Okay, good. Take those out, and I want you to keep your eyes closed. I'm going to draw a number on your hands. I want you to tell me what number it is.
7.
Okay.
3.
Okay, great. And then last but not least, we're going to check sensation and reflexes, okay? So I want you to close your eyes. I'm going to rub a cotton ball, and you tell me where you feel it.
Here.
Okay. Good. Good.
Foot. Other foot. Lower knee. Lower knee.
Okay, great. And then we'll check reflexes, and then we'll be done, okay? Yep. So. Okay, good. We'll go ahead and check these reflexes as well. So just relax for me. Okay. Okay. And then we'll check this one. Okay, good. And we'll check the ones down here as well. Flex this. And then we'll check the Babinski down here. Okay, good. Sorry. Okay, great. And that is the end of the exam.
Thank you.
You're welcome.